Well, listen, I would like to welcome everyone to the Medical Marijuana and Wellness Seminar Series. My name is Marc Matoza, and this series is dedicated to providing information about medical cannabis that can help people with their lifestyle medical conditions. And also, today's particular topic, which is dosing, is really one of the most important topics that we actually tackled during this whole webinar series. Without the proper dosing, medical cannabis really doesn't work very well. And as we all know, that this is a touchy subject. People have tried it, not tried it, and there's a number of different issues that come up. But I think it's important that we have the right advice and the right dosing to be able to get the most out of medical marijuana. So what I'd like to do is introduce the two people that are joining me today, Cameron Vance and also Kate from Move. Both of them are going to help us be able to explore this topic and really get your questions answered. Couple of things important. At the bottom of your screen down over here, you'll see a little Q&A button. Q&A, if you have any questions, please ask. And of course, there's a chat button that we don't necessarily monitor, but we would like to be able to have you be able to ask questions, mostly in the Q&A, if that's at all possible. So let's get things started. Cameron, welcome. You're with MMTC of Florida, and tell us a little bit about you and your background.
Yeah, sure. Well, first of all, Marc, thanks for inviting me on tonight for this topic on medical marijuana dosing. It's such a, like you said, such a very, very important topic. And if we work together and we do it right, we're going to set ourselves up for the best chance of success. A little bit about me. I'm a pharmacist. I graduated from West Virginia University, relocated with wife and children down here to Florida. And I've been involved in the medical cannabis industry here in Florida since day one. The very, very early time. So it's been become a real passion of mine, and it's been really interesting to see the market to develop and the success stories that we get every day from our patients. I am with Medical Marijuana Treatment Clinics of Florida, is a physicians group here within the state. And I've had the opportunity, while being here, to be appointed by Commissioner Nikki Fried to the Medical Marijuana Advisory Committee here in Florida. That's given me a great opportunity to network with other physicians and dispensary personnel throughout the state to make recommendations to her, which she then moves forward to make a final recommendation to the legislature for changes to really advance the program for the betterment of our patients, which has been really exciting. I've also had the opportunity to co-chair and be one of the founders of a medical marijuana research consortium in partnership with Florida State University and some work with the University of Florida, where we're working to focus research specifically at this point on the patients in Florida to really set our state up for success, looking at different disease states and improvements and things along those lines. And hopefully through some of these publications, we'll be able to spread some of the good word out to the rest of the country and beyond. So it's been a really exciting time here, and I really appreciate you having me on. I'm glad everyone here was able to join tonight. It's exciting to see people from throughout the state, Northwest Florida, Jacksonville, Denver, New York, and beyond. So thanks for sharing where you're from. Very excited to be here. Thank you, Marc.
Yeah, thank you, Cameron. And you've been very instrumental in helping literally thousands of patients getting their dosing right. So it's good to have you on tonight. Kate, you're with Move, and I know I've had a chance to work with you and also Move in the past, and you guys have done some great work, not only in the medical cannabis field here in Florida, but also in dosing. Tell us a little bit about yourself.
Okay, well, the same thing Cameron said. Marc, thank you for putting this on. Thank you for educating the Florida communities on everything cannabis. Cameron, thank you for offering your expertise tonight. My name is Kate Palazzolo. I work with Move. I'm the area sales manager for Central Florida and surrounding areas. Been with the company for about 2 years now. And basically what I do is I educate the physicians and their staff on everything Move that Move has to offer. One thing that you'll find when inside a Move dispensary is that we have a very wide selection of products. So it'll be easy for you once we talk dosing, once Cameron discusses dosing, for you to find that controlled dosing that's just right for you inside one of our dispensaries. A little bit about Move. We have 32 locations here in Florida, and we're continuing to grow. We had a merger back in November with Verano Holdings, which is out of Chicago. And by the end of the year, we will collectively, we'll have collectively about 100 dispensaries in the United States and Canada.
That's fantastic.
So I'm excited to be here and look forward to answering some of your guys' questions and teaching you about Move and our
Great.
products.
Well, listen, let's get right down to it. Cameron, why don't you share your screen and take it away?
All right. Do you have my screen here?
Got it.
Excellent. So again, thank you all for being here tonight. So medical cannabis today, finding your dose is the topic. Doing some thinking about this, I thought we would just kind of have a conversation essentially on, how cannabis works. I'll try and highlight that, but not go too in depth during this webinar tonight. I think it's really important that we understand what our dose is targeting. Why are we talking about dosing? Where does it work? Having a fundamental understanding, I think, will pay dividends in the end. And then I'm going to pivot a little bit to some of the dosing concepts so we can think through together why we go one way versus another. I see some questions in here about edibles and things like that already. So I'll make sure we touch on that. And then finally, I'll come in a little bit at the end with some different dosing strategies that I find to be very useful that patients find success with. And also touch on some of the pitfalls, some things to be aware of, how to be careful, how to set yourself up to succeed. So diving right in, let's go ahead and get started with how cannabis works. So if we're going to talk about cannabis, I think I've learned from year one through now that most patients have begun to learn the term, the endocannabinoid system, at least briefly. So I won't go too depth in it, but the endocannabinoid system is where cannabis action is going to take place. Interestingly enough, a lot of physicians that I've met with over the years and across the country have come to me and said, I really know nothing about the endocannabinoid system at all. It was never taught in med school. It wasn't taught in my curriculum in pharmacy school up in West Virginia where I got my doctorate. But over time, patients like you that are bringing yourself up to speed and asking your physicians these hard questions or even about their stance on cannabis has led to physicians diving in and doing research and learning more about it. And really you're empowering other patients you may not even be aware of. Your question today would impact the next patient on down the line. So I applaud you on that. So with regard to the endocannabinoid system, every one of us on this chat today has one. If we're a vertebrate, we have one. They've even located them in fish. And it's a system just like several of the other systems we have in our body. We have for example, cardiovascular system, and we have a respiratory system. Just like that, we have an endocannabinoid system. And in different disease states, what we're finding is whenever, for example, our cardiovascular system, it's doing perfect, and all of a sudden we go to the doc, he says, hey, you got some high blood pressure, things kind of get out of balance. And what we do is we treat it to restore balance and increase our outcomes long term. Same thing's going on with endocannabinoid system, nothing more. We have receptors in our body. We're talking about a cardiovascular system, like for blood pressure. So our blood pressure is high. We have these receptors called beta receptors. And if our blood pressure is high, we might use a beta blocker like toprol or metoprolol, something like that. And essentially what that does is it blocks that receptor and then restores balance. Same type of idea. What's fascinating with cannabis is that they found that the endocannabinoid system is involved in virtually all human disease states. And the way I like to look at the endocannabinoid system and the cannabis interaction with it is like it's curing or mitigating a nutritional deficiency. It's really forming or reforming that homeostasis. We're all doing great, we're doing fine. Maybe we end up with anxiety or back pain and the levels get off. And where cannabis does its work within the endocannabinoid system is to restore that. And I'll work with you to better understand how. Just like the receptors in the body for the cardiovascular system or the respiratory system, we see somebody have an asthma attack. They have all this inflammation going on, can't breathe. They may grab an inhaler like albuterol, Provenol, ProAir, different names for it. They do a couple puffs, they stimulate what's called the beta 2 cells, and the lungs, relax and they're able to breathe again. Well, we have receptors that we're targeting with our cannabis dose. And you can see them here in green and also here in blue. CB1 receptors are primarily in the brain and spinal column. They're also in the liver, the pancreas, the GI tract. And then we have in blue here are CB2 receptors. They're thought to be really more involved in the immune cells or the immune system, the blood cells, the tonsils, the spleen. But we're not limited to just CB1 and CB2 receptors. They're doing a lot of research on a CB3 receptor. There's TRPV1 receptors, and it goes on and on. But these are the most well understood characterized receptors that we're working with today. And it's where a lot of the time, effort, and research has gone into when dialing in a cannabis dose. Next, we have, so number one is receptor. Number two, we have something that binds to that receptor. And number three, we have something that breaks up that bind, okay? So right now, as we're sitting in our chairs, say we have some nerve pain, my arm's not feeling good, I'm feeling this throbbing. What's essentially going on in our body is there's a signal coming down from our brain back and forth, and it's saying, hey, I feel this pain right here, it's hurting. So basically within the endocannabinoid system, you have these endocannabinoids, which are AEA, which is anandamide, and 2AG, which is 2-arachidonoglycerol, are two of the examples. What's happening is you've got these abnormal pain signals telling my brain I'm in pain. These endocannabinoids like anandamide and 2AG get released. They bind presynaptically, and they tell the body, quit sending all these abnormal signals, bring back that balance, that homeostasis. All these things that are being released, this inflammatory signals like glutamate and acetylcholine, and it goes on, it helps restore and calm those down. And then once we have that binding, we have these FAAH and MAGL there at the end that basically they grab a hold of them and break them apart, and then they start new. So you have a new binding, a new breaking apart. And it's all this matter of restoring a normal balance. And it's happening in each of us as we sit here today. Disease states, we get off, right? We get out of balance. Maybe we don't have enough of these endocannabinoids. And that's when we start to see these flare-ups.
Cameron, just interject for a second. Your body knows when it has a problem. It doesn't necessarily, you may think you have, for example, knee pain, or you may have shoulder pain or something, but your body you don't need a doctor to tell your body where your problem is. Basically, through your endocannabinoid system, your nervous system tells your brain that you have a problem, and that creates the endocannabinoids that go and actually go to try to treat it. Is that correct?
Absolutely. And with cannabis, it works almost like an adaptogen, which is unique, where it says, hey, I don't have enough. So it helps the body produce more, or if I have too much, which we'll get into in a little bit, it'll produce less to basically restore that balance. What I think is super fascinating, we have a lot of patients, for example, with fibromyalgia. We probably all know somebody with that condition, even IBS or migraine disorders. What they're finding is that these patients don't necessarily have this balance. They're out of balance. And what they have is a low endocannabinoid tone or an endocannabinoid deficiency. So the fibromyalgia is like, they get all these different pain signals a lot of times going on, don't exactly know why or where, and they're finding low tone, or maybe they don't have enough AEA or 2AG to get to that balance. And we see such incredible results a lot of times with these types of patients, because cannabis, which I'll get into, it works to restore that, which is really, really amazing. So
I think another thing to point out is that I think your body produces the endocannabinoids naturally. What happens is that when you have some sort of a problem, you may need, let's just say you may need some extra fuel in the tank to help your body get the endocannabinoids to that particular part of the body. And I say that because I'm a senior citizen and my body doesn't produce the endocannabinoids now that it did when I was 20 or 30. And so sometimes that's why cannabis works so well with seniors, is what you're doing is you're providing your body basically the elements it needs, or the material it needs to basically heal itself.
Right, you're supplementing the body just like you take a multivitamin a day, perhaps.
Right.
You're restoring some of that balance is one way to look at it. Yeah, I agree completely. And essentially, if we know that the endocannabinoid system is involved in virtually all human disease states, being out of balance, if we can restore that balance, we're setting ourselves up for success. And one interesting thing as a pharmacist that I found is, and we find it unfortunately a lot, not a lot, but sometimes with different medications, is we'll find this great blockbuster drug that gets released to the FDA, goes on the market, and then after a while it gets recalled because all these, when a larger population of people see it, they start to find these adverse effects that weren't found in clinical trial. Happens at times. I notice it more in the supplement side of things, definitely dietary. And there was a drug. We had this idea that, okay, we think of cannabis. We've all heard the the joke, cannabis can give you the munchies kind of thing. Well, there was this drug and they thought, hey, you know what? If we can block that CB1 receptor, the one in green, and we can prevent the AEA from binding perhaps, maybe we can have a blockbuster weight loss drug. And it did, it worked, but they forgot that having this system in place, it has these down the road cascade of effects that it's in control of. So these patients ended up with a lot of depression, actually suicide happened, and the FDA actually was out of Canada, black boxed it, pulled it off the market immediately. And then once again, we gained appreciation for how important having a well-functioning endocannabinoid system is, which I thought was really, really fantastic. You think about it, anxiety, depression, cannabis is used daily to help with that. So it's super important to have, the machinery in check. So as we pivot a little bit towards dosing, a lot of the two phytocannabinoids are things you take from outside into your body that we are most commonly think about or hear about, most of us, is THC, tetrahydrocannabinol. And it's thought to be more of the psychoactive component at higher doses, the one that, potentially can get you high. Just because it's in there doesn't mean it gets you high. It's all about doses. And then CBD, which is kind of thought of as, it's like the yin and yang, like the non-euphoric part of the cannabis plant. Really strong anti-inflammatory, works in a lot of different mechanisms, but it's the one that, really doesn't cause that euphoria, so to speak. It's also found in the CBD portion, also found in the hemp plant, which seems to come up a lot. We see a lot of these CBD stores all over town anymore, some of our grocery stores and things like that. And we certainly get a lot of questions about what's the difference between CBD from hemp and cannabis. And we can certainly touch on that. But the THC and CBD are primarily where our focus for tonight will be on with regard to dosing. When you get out to the dispensary, specifically here in Florida, that's what you're going to see a lot of, how much THC is in this amount and how much CBD, things like that. But I also want you all to remember that it's not just THC and CBD, even though that's what we're going to hear probably the most about, and we know the most about, and quite frankly, most of the research is on that. There's actually over 100 identified cannabinoids from the cannabis plant that are at play here. It's more than just a single chemical. I used to get, kind of embarrassed about it now, but in the very beginning, I used to think, how does cannabis help with anxiety, muscle spasms, Parkinson's disease, all these different disorders? Like, how is that even possible? And the more I learned about it, when I stood back, you start to think, regular medications, typical medications like Tylenol, for example. At the end of the day, Tylenol, as good of a drug as it is, or as bad of a drug as it is, at the end of the day, Tylenol is Tylenol. It does one thing. Cannabis is so much more. It's not the one ingredient, but it's the different cannabinoids, phytocannabinoids, CBD, THC, many of these listed in this wheel here. And then also there's terpenes, flavonoids, and how that specific product comes together when you go to AltMed or Move, for example, to purchase your products, how they're packaged in the proportions. There's how you find what's going to work best for you, more of one part, less of one part, and so on and so forth.
Cameron, you go back for a second. You brought up something that's really important. I think that most of us through our life get used to what I call the pharma approach to medicine, which is one problem, one pill. You go to a doctor, they say, I have a problem with this, and he prescribes something, a pill, whatever. Okay, the difference between cannabis and the pharma approach is that if you take a look at what they call the whole plant, when you take a look at all the chemical properties, all the medical properties, I should say, that are located in cannabis, you can see, for example, that it helps with sleep, it helps with pain, it helps with a number of different things, and it's all in there. And what's even more fascinating is you'll see on the CBD side, it'll talk about how it helps with sleep, and you see on the THC side how it helps with sleep. And when you put those together, you get what's called the entourage effect, which 1 and 1 becomes 3. They become a lot more focused on that particular medical condition. And so that's why people will be able to take it, for example, you take it, I take it for inflammation in my knee, but I found it also helps with my shoulder when I hurt my shoulder. So your body knows what the problem is. The plant has the medicinal properties to be able to help you, and it doesn't need a doctor to prescribe something for you. And that's what I think a lot of people are surprised how much you get out of one plant versus taking 1 or 20 pills type of thing.
Yeah, absolutely. It's super fascinating. And as a pharmacist, the fascination just grows when you start to look at the side effect profile and things like that,
Right.
which we'll definitely touch on. And like you said, Mark, and like a lot of the patients and participants on this call tonight know, it's not just that one ingredient. It is what they call the entourage effect. It's adding all of these components together, which are all greater than their sum. THC and CBD by themselves are okay, but studies show, and I'll show you, together plus these other benefits make it just that much better. And we'll dive a little bit into that. Terpenes are huge, and I'm pretty sure Kate will probably talk about different variations of the cannabis plants, sativas, indicas, hybrid. There was a question about that, and perhaps she can touch on that. But terpenes, all of us, whether we realize it or not, are really familiar with terpenes. For example, linalool is from lavender. My wife, uses lavender around the house, aromatherapy type thing. And as you're sitting there thinking about it, lavender, what do we use that for? It's to help calming, help relax, things like that. Well, that same terpene, even though it's in lavender, can be a part of the cannabis plant. And if we're looking for something to help with sleep or relaxation, we may head for a product that has a little linalool in it. Anyone that drinks a glass of wine, you see a lot of people, they do the swirl sniff of the wine. What they're doing is really they're smelling a lot of the different terpenes within the product. If you're more of a wine chugger, you might bypass that. I've got a 7-year-old and a non-sleeping 2-month-old, so no judgment if you chug or sip, but that's part of our daily life. And the cannabis plant, how it puts these all together in the different varieties is what gives it its value. So we'll keep breaking it down a little bit. I don't want anyone to feel overwhelmed. There's a lot to cannabis, which is amazing, but we can keep it simple, and we can, through individual experience, you're going to dial in and your dose, and you're going to do great. The cannabis plant, I've had the opportunity to go to some of the different dispensaries and see their facilities and their growth programs and how it's grown. What's really absolutely fantastic about the dispensaries here in Florida is they do a really good job. Like AltMed does a fantastic job of growing the products organically, and a lot of science and chemistry is behind the scenes. And as you'll see here on the slide on your bottom right of your screen, there's like this little waxy residue. It's called a trichome. And really what the dispensaries are doing is a lot of the phytocannabinoids, the THC, the CBD, it's found right in that waxy residue. Some is also within the plant, but they spend a lot of time, hundreds of thousands of dollars on equipment to extract that off the surface of the plant sometimes to make your individual dosage form, whether it's a vape or a sublingual drop or something like that. But under the naked eye is the cannabis plant itself on the top left, and you can kind of see that, not zoomed in if you're someone that uses the flower, the little sticky substance you'll begin to notice on the plant. That's for the majority, not all, but the majority of the cannabis medicine is actually coming from. So let's pivot a little bit. I mentioned we'd talk about how cannabis works briefly. I'd like to pivot into dosing concepts. And within that category, really three things that I want you to remember or think about that I think is crucial, very important. Number one, we're finding through research is that less is actually more for most patients. I'll go into depth on that. Number two, I want you to remember that everyone is different. I get calls all the time. We hear from patients, different conversations where my friend's using this and she's doing great, but I'm not. Everyone's endocannabinoid system, like that fibromyalgia example where they've got low tone, it's different. And we have to dial in and treat ourselves as individuals, empower ourselves to not be scared to try different things and use a smart forward-thinking strategy to get to where we need to go. And I'll help you with that.
Yeah, you brought up two really important concepts here. I think the first is that every person's body is different, and I say that because if you relate it back to alcohol, I have friends who have one drink and they're done for the night. I have other friends that they can drink all night. They can drink and they don't even, it doesn't affect them. And I think when you got into using alcohol, you knew what you liked and what you didn't like, and you knew how much. And that has to do with how it reacts in your body. Cannabis is pretty much the same way. Being able to find out how tolerant you are to THC or the CBD and how much is really important. And just basically being able to find your sweet spot, which you're going to talk about, Cameron, yeah. I think is really, really important. But just realize pharma is something where take 2 pills and call me in the morning. This isn't that approach. This is something where the medical marijuana doctors, I know your medical marijuana treatment clinics in Florida has a dosing center. You can call and get help. The idea there is to be able to help you be able to find your sweet spot and do it fairly quickly. Now, it does take a little experimentation, just like when you try to figure out what kind of alcohol you like to drink. But it can be done fairly quickly. And when you get it, fundamentally, you get your life back.
Yeah, absolutely. Absolutely. And I'll help you with understand a little bit better some dosing strategies as we move along. So yeah, definitely number one, less can be more. Everyone's different. And the third point I'm going to hit on real quick is THC and CBD, for the most part, and almost all conditions, they really truly work well when used both combined than one by itself. But if you're someone that's only going to do one or the other, I've got a strategy to help you out with that as well. So,
well, and I think also if you are in that area, the question is how much of one versus the other. I know when I had my left knee replacement, I obviously was looking at THC for pain relief, but I also, because I had the inflammation, I was able to use the CBD to help lower the inflammation and then again reduce the pain. So it's a matter of just being able to get that monitored and get that correct, especially right after the operation, 2 weeks after the operation, and even like now, which is 2.5 years after the operation.
Yep, absolutely. Right. So for as far as less can be more, me demonstrating kind of how that works, it's thought of as the BB gun approach or the shotgun approach. Shotgun approach is obviously you take a large, super large dose or a large dose. That's going to work probably, for some people. You take a large dose, you feel something, maybe you feel better. But really for 90% of patients, we don't want to feel better. We do want to feel better right now, but we want to feel better over the course of time, like daily, like all the time. And we want to be able to function as well. We want to be able to take a consistent dose daily and be able to go about our lives and get our life back. And what we're finding with the BB gun approach is that you can achieve success on much lower doses. And actually, in the long run, you'll do better than somebody that's using these high super therapeutic doses when done consistently. And kind of a exciting part about that as well, from my end, is it costs less. You use less, you need less, it costs less, and in the long run, you do better. Unfortunately, fortunately, some people, it's human nature. You take maybe you take a little bit of one and you're like, I didn't feel anything. I don't feel better. All of a sudden you jump into more and more and more. Cannabis, if we slow down, start low, go slow and work our way up, I'll help you with that in just a moment. You're going to be more successful.
Just on that thought, I know when you look into diets and things, a lot of the diet strategy is to eat maybe a few meals, but 5 times a day rather than 1 or 2 big meals. And that's basically the same principle.
Yeah, yeah, interesting way to look at it for sure. This slide just kind of demonstrates that, look, we're all different. Now, some patients will do on 1 milligram a day, they're good to go. Well, another one, 2,000 milligram is where they need to end up. Now, that being said, these are major outliers. The majority of patients are going to be well between those. But it just demonstrates that everyone's a little bit different. And we need to keep that in mind and just treat ourselves as an individual and don't focus on what's going to work best for our body. Dosing challenges. Cannabis doesn't follow the standard dose with normalized pharmacologic, go to Walgreens, buy a prescription, pharmacy. A lot of times, for cholesterol, for example, maybe we're on a statin. We've probably at least heard of them. Something like Lipitor, for example. And say our LDLs or cholesterol's high, doc writes us 20 milligrams because he knows it's going to bring down our cholesterol in general, this percentage. 40 milligrams will do that much more, 80 milligrams that much more. Same with blood pressure, 25 milligrams of topiral, we need more. And it's just a consistent trend line to a degree. With cannabis, what we actually get in is this bell-shaped curve. So a low dose, as we build up, we're going to max out at this point. And then once we hit the saturation index, for the most part, we're going to be headed back down. So what we're trying to find is that sweet spot. And if we find it, which you will, you'll be able to do consistently dose medication without, adverse effect. Now, if you need a boost here and there of something, that's fine. But it's all about if we start low and go slow, we don't overshoot that and we're just guessing. What we do is we end up gradually working together to get to that sweet spot. And I'll give you some tips. Here's a study that kind of supports that evidence. This was looking at patients with poorly controlled pain. They found that the group that was receiving 83 milligrams of cannabis combined with THC and CBD did no better than placebo. They found that patients using the smallest dose of 21 milligrams experienced significant improvements, and they did even better than those with the 52 milligrams. What it's hitting on in that study is we're going over that slope. In microdosing, starting low, going slow, and finding our perfect sweet spot, yes, you can do better with higher doses, but you can be chasing it and need more and more and more expense, and it's unnecessary if we take our time.
Well, I think it's human nature that you take more to hopefully get it to work, and in certain cases, what you have to be careful with cannabis is sometimes taking more actually works against you in the medical marijuana field. Okay.
Yeah.
And I think that's something that's really important. It's kind of counterintuitive to the human animal, but it's something that we have to pay attention to make sure you get optimal performance from your medical cannabis.
Right. Yeah. And I definitely, I get, patients, it's human nature. You want to feel better. At the end of the day, you just want to get back, have your regular life, feel good. And we just, a lot of times we just get frustrated and we want to ramp it up and get there. But a lot of times I try to remind people, look, we're year 4. We waited this long. If I can just give it a couple weeks of slow titration, we're going to set ourselves up for a better chance of success. This slide here essentially demonstrates that is when we overstimulate these receptors, remember the CB1, CB2, blue, green receptors, when we flood them with all this medicine, all this cannabis, they become desensitized and they'll actually take the receptors inward and they won't receive it. Because they're like, hey, my body, it's almost like a negative feedback. It's like, oh, my body's already got all this produced. I don't even need to receive anymore. So what happens is we take more and more and more, and eventually when you take enough, it'll flood those receptors again. But if we get back to the balance, the receptors will not only function more normally, they'll actually create new receptors to be more receptive of the cannabis. But if we suddenly just flood it consistently all the time, they start to go inward and they become less available, and you need more and more and more to achieve that same response. It's essentially along the lines of tolerance at the end of the day. If you're sitting there thinking, oh gosh, I've been taking too much, I've been doing these high doses, I'm not feeling great, The great part about cannabis is we can fix that. There's certain medications out there, lots of them, in fact, but one that comes to mind is some of the ADHD drugs is ADD, ADHD, hyperactivity. A lot of the physicians and that, that prescribe those type medications, they always recommend a drug holiday. Give your body a break, let the receptors reset. If we're taking these high levels, even with normal cannabis dosing, if we can get away with it, if we can take off a Saturday or a Sunday or every other Saturday and Sunday, it kind of lets the body, kind of regenerate and restore a little bit of balance and loses some of that overstimulation. And then long term, you do better. Now, if you're somebody that's been using this high amounts for a long period of time, taking off a Saturday is not going to reset you to baseline. In those situations, if you're truly trying to reset, that can be a month or two of no cannabis use. But for the majority of patients, if you can get away with a day off every once in a while from your treatment and you're still feeling okay, you can help your receptors.
Cameron, on that note, I take medical cannabis for two reasons. One is I was in an auto accident about 4.5 years ago, and I have 7 herniated discs in my neck, which is just no fun. I can sometimes wake up in the morning with, if I don't pay attention to my cannabis regime, with a level of pain of a 7 or an 8. And also I had, as I mentioned, my knee operation, so I have inflammation in my left knee. And I found that about every 6 to 8 weeks, if I just take a day off, just don't use it for a day. It's interesting. There are two things that happen. By the middle of the second day, my neck is tapping myself on the shoulder saying, you better do something because the pain's coming back. So I'm not addicted to cannabis. I'm addicted to getting rid of the pain. But I have found that I take less medication, I take less cannabis to get the same effect. Right. In other words, by taking that holiday, I was able to reduce the amount of cannabis my body needed, or at least I needed to give my body to be able to achieve the same result.
Yep. Yeah. I mean, it makes perfect sense. It's resetting a little bit of the, I guess you could say, tolerance to a degree, if you can get away with it.
Yeah.
As far as THC and CBD, this slide and study essentially demonstrates that patients had better outcomes when using the combination of both THC and CBD than when they used it by itself, one or the other. I think it was a 20% better response. And it's how THC and CBD, they really complement each other and how they interact with the receptor. And part of it is, again, some of that 1 + 1 is 3, I think is how you described it, Marc. Some of that, that harmony working together. So just to go back over this, less can be more. Each of us are going to be different. We're going to have a different response. And if we can do it, THC and CBD together, certainly have demonstrated, and more than just this study, that uses a combination, that you're going to do a lot.
And people ask, I love that people ask for studies, and I think that's appropriate. We need to provide them, and I think the pharma industry gets us conditioned to studies. The best study I've found is your body or yourself. And I use my wife as an example. She's very, very susceptible to THC. I mean, it's something we'd be careful of. But if we give her CBD only, it doesn't address some of the issues that she's addressing. If we use just a little bit of THC, in her case, we use like a 12 to 1, or we use like a 9 to 1 of CBD to THC. It's much more effective than if we went with CBD only.
Yeah, absolutely. And what's powerful and exciting and about, what we'll learn from Kate today. I mean, 5 years ago, patients would come to me and say, hey, I'm using cannabis. It really helps me. And I was kind of like, I didn't really understand it. And I didn't really know where they were getting their medication necessarily from. And at the end of the day, they really didn't either as it came out, but they were doing well. But, they would ask me, like, how much am I using? How much is this? And it's like, there was no way to know. But with people in the industry passionate about, giving patients a good product like Kate, now all of a sudden, we know exactly what we're taking. So it's becoming more of a normalized medicine, meaning normalized dosage forms, capsules, sublingual drops, sprays, patches, creams. And in Florida, with the regulations in place, the dispensaries, for the most part, are growing organically based cannabis plants, pesticide free, heavy metal free. And what they tell you, like say on the label that the product's 10 milligrams, for example, at the end of the day, it's 10 milligrams. So you know what you're getting, and they report it. If you're interested, most of them, I think all on their website, you can type in the individual lot number on your bottle and it'll show you the exact lab test. So they all hold themselves accountable in the regulated market to make sure that what they produce and what they say it is. So that's really fantastic. So now when a patient wants to know how much they are taking, instead of, it's like, well, who'd you get it from? It's every single time I take this dropper full, I am taking this many milligrams. So I want to
one
kind
of
of,
the things, Cameron, is with my particular situation with pain, I had to wade into the waters of heavier THC to CBD, whether it's 2-to-1, 3-to-1, whatever it is.
yep.
And there's two things that were there. It took me a while to experiment with the 4-to-1, 4 THC to 1 CBD. I tried as many as 9-to-1, and in fact, sleep, that really helped quite a bit. But what was fascinating was one of the reasons why I like Move, and I'm going to mention this, Kate, is that Move has products where they have CBD products. They have, of course, the 1-to-1 products, then they have THC products. And what I was able to do with the Move products is, in essence, almost mix my own cocktail. I put in, 3 drops of the CBD and 1 drop of the THC to find out if that works. Or I'd try. In other words, I could try different formulations to find out what worked well in my body, because my body would tell me what worked and what didn't work. And I didn't have to go buy a bottle of this and a bottle of this and a bottle of that. I could use the same Move products all the time. I think that's one of the advantages of the Move product line.
Oh yeah, absolutely. So if you're sitting there, I want everyone that's trying to figure out their dose, and Cameron's telling me less is more. Okay, got it. Everyone's an individual, got it. How do I get started? What do I do? He says low doses, micro doses. What does that mean? And I want to share that with you. I want to show you some of the pitfalls that I've seen. Number one, I highly, highly recommend that you get a journal and you write down exactly what you're taking. What we run into a lot, or what I see a lot, and back before COVID, when I was able to meet individually one-on-one at some different seminars and things like that, patients would say, and I'm sure we'll get some questions tonight, well, I take 1 dropper full of this at AltMed, for example. How much am I taking? And then in the morning, I take 1 dropper full of this from TrueLeaf. Now that we're into the normalized medicine and we can keep a journal, what we need to instead focus on is not dropper full. We need to focus on milligrams. When you go to AltMed or Move, and they say their product has 5 milligrams of THC, and you go to Certera or TrueLeaf and they say their product has 5 milligrams of THC, at the end of the day, a milligram of THC is a milligram of THC, right? But if you say a dropper full at Move and a dropper full at Knox, those can mean 2 wildly different things. So even on the package you have at home, like when I'm dosing my child's Tylenol, for example, I'll give him, for example, 10 milliliters, just like you're thinking, a dropper full, 10 milliliters. On the back of that package, it's going to say 10 milliliters, or on the side, equals this many milligrams. So as long as you record, okay, I took 1 dropper full, which is 10 milligrams, whatever that number is, no matter where you go, 10 milligrams works for me. I need to, stick with that. If you get lost in the translation of anything else, it'll be really, really hard to compare apples to apples. And at the end of the day, with all the products coming out daily, it's harder to provide advice. But if I know you're doing 10 milligrams and you're not doing as well, and we can look at 12 milligrams, like we're able to talk the same language more fluidly. So definitely keep a journal. So
Cameron, can I interrupt and just add something to that? So journaling is great, but there's also this wonderful app out there, and it's called Strain Print. Strain Print is not specific to Move. Almost all of the dispensaries are a part of Strain Print. And what you do is you put in, it's basically an app that's also a journal. So you put in what your symptoms are, what you're trying to get relief from, and then how much you took and when you took it. And then based on what it is that you are taking, your phone will buzz you when it should have been activated at that point. And then it will ask you to rate your, how is your pain? How would your stress level be? How are you feeling right now? Because a lot of times what happens is if you just journal on regular paper, you write down what you took, you wrote down, where it was from, and then you float along throughout your day and you kind of forget, like, was it really working? I don't know. I just kind of went about my day. Where this particular app, which is called Strain Print, will ask you throughout your day, how is that medication working? And it will give you a little buzz. And even if you're exploring different products, you can say, if you're trying to get relief from PTSD or you're trying to get relief from anxiety, it will suggest things that other people have also taken for those same type of symptom relief. So it's a really helpful journal.
You can get Strain Print from your website. Is that correct, Kate?
Yes. Mm-hmm.
It's Strain, STRAIN print.
Mm-hmm.
Got it.
And I should mention that as a follow-up to this webinar, everyone will get an email and a link to a web page that has a copy of the video today, the presentation, notes, and then also we'll have information about how to get Strain Print and a patient information brochure. It's like a frequently asked questions and a guide to walk you through and help you with your medical cannabis regime.
Yeah, for sure. And that's a good point. Marc brought it up earlier. He takes a drug holiday and then a couple days later, he's like, oh, wow, I need, I'm hurting again. I see it all the time. Patients, we start feeling better and it's our new normal and we kind of forget how far we've come. And I think to Kate's point, rating how you're feeling will kind of help you remember, okay, yeah, I did do pretty good at this. So when I've studied out west with some of the physicians that were a little bit ahead of us, different conferences, even in Florida, one of the, when it comes to finding your balance, one of the ways to find your specific dose for you and start low, go slow is what they term as a minimum psychoactive dose. And what that is, it's the minimum dose that it takes for you to feel something. Like most of the time it's maybe you feel a little bit of potentially a buzz or a high, or you just feel a little bit out of sorts. So what the strategy to get started to do well is really to find your minimum psychoactive dose and don't let that scare you. So when I say start low, go slow, and I say let's start on low doses, for almost every condition, I'll put epilepsy in a little bit of a box because they need a lot more CBD most oftentimes, but almost every condition of pain, anxiety, things like that, most patients, like I mentioned earlier, are going to do better on a ratio of 1:1. So when I say 1:1, what does that mean? I mean, if I'm going to take 1 milligram of CBD, I want to take 1 milligram of THC. If I'm going to take 5 milligrams of CBD, I'm going to take 5 milligrams of THC, equal parts, 1:1. And for most patients getting started, something in the realm of 5 milligrams of CBD and 5 milligrams of THC is a really good place to start. And what you'll do, let's say you're going to go with that. Some could use 4, some could use 7, but 5 is easy to measure out at most dispensaries and calculate. If we do 5 milligrams of CBD, 5 milligrams of THC, and we can do that 2 or 3 times a day. Most will do it 3 times a day. And we're going to do that dose for 7 days, for a week. You may not feel better right away. We've been battling to get here, but we're gonna hit that curve. We're gonna hit that peak. So let's do that for 7 days and see where we're at. Okay. Now the next week we can bump that up theoretically to, instead of 5 and 5, let's go to 8 and 8, and we'll do that for 7 days. Are we doing better? Yeah, I'm doing better. I could probably do a little bit better. We go to 10 and 10. So we're still on that 1:1. Now, say in your situation, everyone's going to be different, but a lot of times 10 milligrams can be the amount that can make you feel something, quote unquote. If you do 10 milligrams and you're like, okay, that, I'm not going to be able to go to work and have my daily life at this point using this much. I feel something. what we do is we take that 10, we're like, okay, 10 is my minimum psychoactive dose. I felt something, but I didn't at 8. So we go back to 8 and 8. And that's our dose to get started. And we're going to continue that. And every change we make is on a 7-day scale. Now say, okay, we're doing 8 and 8. I'm feeling pretty good, but I wonder if I could do better. This is when we get into these crazy ratios of 6-to-1 and 7-to-1, all that kind of stuff. Remember, 1-to-1 means equal parts. If it's 1-to-7, that could be 1 milligram of THC, 7 milligrams of CBD, or vice versa. You got to pay attention. But say that, we did the 10-to-10, we felt something, we're like, okay, I'm an 8-to-8er, but I want to do better. Now we take that CBD and we continue the 8, and we continue of THC, the 8 of CBD, and now we add that non-euphoric yang, and we start to add more CBD and see if we get better. So now I might be on 8 each dose and 12 of the non-euphoric CBD. And we do that for 7 days, and we can bump it up even more, right? But we can leave this euphoric part the same. And generally, if you start low and you journal and you start at a 1-to-1 ratio in most conditions, and you change just every 7 days, and you find that ceiling, back down a little, and then if you need to feel better, you start moving up that CBD, you're going to be headed in the right direction. As time progresses, and I'm talking, months, and you're getting comfortable and confident, and you're trying different products, things like that, then you can start to play around a little bit with some of the different varieties that are coming out, like the THCAs and CBDAs and CBGs and CBCs and all those different endocannabinoids. But just keep it simple, stupid in the beginning. And then most people, that's all they ever need. But if you get to a point where you're like, okay, I've done all that and I really need to get somewhere else, you can start to play with those other cannabinoids and see where you get.
Yeah, and you're bringing up a good point. When you understand what your tolerance is to THC, then it makes it easier to be able to figure out some dosing formulas and things like that. Because if you're in my case, for example, I need to work during the day. I need to be able to work on, I need to be cognizant. I need to drive. So I need to be able to know what my tolerance is for THC, but I still need hopefully to get rid of some of the inflammation, that gets rid of the pain. So I'm able to take a higher dose of CBD to THC and be able to solve my problem of being able to reduce the pain and be able to have a normal life.
Yeah, absolutely. And don't let THC completely scare you if you're one of those people. I like to think of it, just because I have a sip of beer, I don't get drunk. My wife might, I don't. So it's just having that little bit on board for you it doesn't need to be scary. Now, if you're in the camp and I had a patient, for example, Parkinson's disease, really powerful story. He actually had tremors, but more so in the beginning, we're just helping with sleep and anxiety and getting him back to normal. His wife kind of did a lot of the bookkeeping and the tracking the dose and things like that for him, and was his caregiver. She in the beginning was like, we're not doing THC, we're doing CBD only. And I said, okay, well, I understand that, and I'll support you, and let's do it. But the literature shows me that in Parkinson's patients, for one, with the tremor, not everyone is going to have their tremor resolved. Unfortunately, it's not everyone at all. But the studies show if you do THC and CBD both, you have long-term, you have a better chance to help with some of that rigidity and things like that. The studies that I remember was like 2.6 months, some time of consistent dosing if you're going to have any chance with tremors. But, there were other things going on as well, sleep and depression and all that. And he was doing great with that. But over time, she decided to try out the THC and called me back one day and was like, look, Cam, like he was able to have coffee without the fear of spilling it on himself for the first time, like in a long time. And that was really powerful to me and amazing. They went with that approach and they did well. But if you are in that camp that says, look, I'm not going to do any THC at all. And that's fine. and I need to do CBD, I want to help you here. With the CBD formula, you can start out the same way. I would probably not start with 5. I'd probably start with 10. And you can go 10 to 15, 15 to 20, and you can keep going that way. But I want you to remember, when we get this cannabis plant from the dispensary, it's going to have a little bit of THC in it. And especially those that are going to require a lot of CBD. If you get a ratio that's, I see a lot of times, like, I'll have to ask Kate over there, I don't recall, but you'll have like a CBD only type product that's like 12 to 1. So that means 12 milligrams of CBD, 1 milligram of THC. Well, now when if we end up taking a double dose, instead of 12, it becomes 12 plus 12 is 24, and that 1 becomes a 2. And if we go up another 12, we go 36 and 3. And eventually that THC, it's going to creep on you, especially if you end up needing higher and higher doses. So when you're looking for that, I'm only going to do CBD only type product, you want to find something with the highest ratio you can find of CBD so that THC doesn't catch up on you. So just be aware of that.
I think you brought up an important point we should bring up again. Having a sip of, don't be afraid of taking a sip of beer. Don't be afraid of THC. As long as you know what your tolerance is, and as long as you pay attention to it, you'll be able to manage that, and it helps quite a bit. I think if you're afraid to head down that path, you're really going to take away the entourage effect and a lot of the real benefits of using cannabis. Again, you don't need a lot of it, but a little bit will really help you go a long way. Yeah,
they really enhance each other's benefits while reducing unwanted side effects. So they do, if possible, they do work really well together. Like I mentioned, standardized dosage forms. I think Kate will touch on it. But what's really awesome is, sublingual drops, vape pens, flower, edible, topicals, suppositories. It goes on and on. It's becoming very normalized medicine. So I'll get questions all the time, well, Cameron, okay, what should I use? Which formulation? And I honestly, they're all really great options depending on the situation. They all have their benefits. They all have their drawbacks. Like, for example, say we're going to do 3 times a day of a sublingual drop that we let dissolve under our tongue for a minute before we swallow. What's great about it is dose consistent medicine, and it's going to work in your body a little bit longer. What's a bummer sometimes is it takes a little bit longer to start working. Whereas like you do a vape, like an inhalation, a vape pen, that one can work really quick. What kind of stinks about it is it doesn't work as long. Some people will find that, and especially if you're starting out, in my opinion, doing the sublingual drops 2 or 3 times a day. You may need it 3 times a day if you're having breakthrough pain in the middle of the day, if you're somebody with pain. But then having like a rescue available, like a vape pen for breakthrough pain, a combination of the two can be great. So I do my drops 3 morning, afternoon, and evening, and then I do my vape as needed.
Cameron, you're talking about my regime is what I call it. When I wake up in the morning, I have a regime where I take sublingual drops. Okay, and I know that sublingual drop will take, in my particular case, about 20 to 25 minutes to work. But if my pain level is a 7 or an 8, I sure don't want to wait. If I don't have to, I don't want to wait that 20 minutes. So I grab a vape pen, and I take 2 hits off of a vape pen, and literally within a minute or two, my pain level goes down to a 1. And because the vape pen lasts a couple of hours, what happens is we got a situation where I can be able to do the vape pen, and then it goes right into the tinctures, and it helps me quite a bit. So mixing and matching is there. And I also keep that vape pen because, again, it's a knee issue, it's a neck issue. If I bang into something or I hit a curve or something like that, I can have an instant pain relief if I need it. Let's put it that way.
You're boosting that anti-inflammatory effect of cannabis. I mean, it just makes sense. And you can actually, if you're journaling, some of the different if you're journaling and you're doing a vape pen, in general, they're going to have the amount of milligrams on that too, not just the milligrams in the pen, but most of them say 1 inhalation of 3 seconds is equivalent to 5 milligrams or something like that. It varies per place. You got to look at your package. But if you're like, okay, every time I hit the pen for 3 seconds, that was 5 milligrams, jot it down. I took 5 milligrams of this. And then, so when you go to another place, if you bounce between places, I need 5 milligrams from your store. Like, I know what to get to stay the same. Unfortunately, products get discontinued every once in a while, and patients like, I was doing so great on this one and now it's not available. If they knew the amount of milligrams they were on instead of just a dropper full, you can quickly work towards a substitute type product.
Yeah. I know Kate's gonna get into this, and Kate, I'm gonna cue you up for your discussion. When you take some of those, if you go back for a second, Cameron, if you take the different forms of administration, it's not just that form, but also Move has an encapsulation technology built into their products. I'll let Kate talk about that actually allows those products to work not only faster, but more effectively. And I'll let her work through that. And I'm going to throw a shameless pitch to your transdermal patches, because I am a huge transdermal patch person where I can actually put on a patch of CBD 1-to-1 or THC, and it's good for 72 hours. And it goes back to your microdosing, Cameron. For me, the best way that I microdose is by using a Move patch. And I love the product, and you're going to talk more about it, Kate, but I think it's something that's really important to understand.
And what I'm finding, what a lot of patients will do is what we call stacking. So they'll use that transdermal patch. It's going to kind of keep them from having those highs and lows throughout the day, keep them a little bit more even keeled with the CBD and THC at a 1-to-1 ratio. And then 9 times out of 10, everything gets a lot worse as the day progresses. So patients are going to want to stack with that patch. So they'll come home, they'll, they may take a hit off of their vape or some flour, and then that'll help to relax them a little bit. But then, while that's wearing itself out, a lot of patients will take a capsule or they'll do an edible, which is going to help them fall asleep and stay asleep for a long amount of time. So a lot of patients across the board, whether they come to Move or go somewhere else, they end up stacking just based on what they need at that moment. So if they need immediate relief, like you were saying, Marc, they'll, you vape because the most efficient way to get cannabis into your body is through the lungs. So, you either do a vape or you do flower or an inhaler, which we have, and that's going to be quick acting, but it's also going to be quick to exit the body. So you need immediate relief, do that. If you need it to last long, then you're going to take an edible. Right. So we can get back into that as we get into
as you start using and you understand your sweet spot or getting close to your sweet spot, you'll figure out the right route of administration. So Cameron, tell us a little bit more about proportion.
Yeah, so like to Kate's point on edibles, because I've seen that question pop up, a pitfall, something to be aware of. You've probably heard of it before. It's essentially this graph right here. The left side of your screen is when it's inhaled. So what happens is when we take a medication into our body, pharmacologically, if we swallow it, it gets absorbed, it goes by the liver. The liver takes that chemical and changes it, and then it keeps, going through the body, back through the liver, just keeps processing, right? Well, some medications, like in something you inhale or even a suppository, it skips the liver the first time around. So when inhaled on the left, you'll see that orange little Pac-Man right there. That's 11-hydroxy THC, okay? And 11-hydroxy THC is 3 to 7 times more potent than regular THC. So when we inhale it, not very much goes to the liver until the second time around, and then some of it gets converted and it can become more potent or more of a high, for example, if it's THC. When you swallow it, like an edible, you chew it up, you swallow it, it goes through the liver the first time and the second time. So more of it is converted over to the 11-hydroxy, which is more potent. So the pitfall is, like, say, for example, I take 5 milligrams or 10 milligrams of my vape pen and I'm fine. If I take 10 milligrams of an edible, it's going to convert by the liver and it's going to have a more pronounced effect. So you might be like, wow, I felt a lot more from that edible. Well, it's because it's being broken down by the liver into different components. So you need to be aware of that. And where you see some of these stories come out, sometimes it's from comedians, it's realistic though, is that vape pen, like Marc said, it starts to work quickly. The edible, the downside is it takes longer to work. So if you're not thinking and you're like, oh, it didn't do anything, it didn't work, it's going to work. It's going to take longer. So unfortunately, sometimes people say, oh, it didn't work, they'll take another one. Then the first one starts to happen. You get the feeling, and it's more potent because the liver changed the chemistry of it. And then the second one, you can't undo if you took it. If you start low, you go
edibles,
slow.
you got to be patience, grasshopper. One must be able to be patient about what you're doing, because you see, not only if people, it takes usually 20 minutes to a half hour for you to feel an edible. People take something and 10 minutes later, when it doesn't work, they take another one. What happens is you're doubling the dosing, and then more importantly, you're doubling the potency of those doses.
And it can take up to 2 hours to actually feel those effects. So if you've ever heard a story of someone a long time ago, back in high school, I went to a party, had a brownie, had a cookie, 2 hours later, I ended up in the ER. It's because they kept eating it because they weren't feeling anything, because you're used to feeling it right away when you're inhaling cannabis.
Right.
But then you eat it and you're waiting, you don't feel anything, you eat more. And then lo and behold, now it's 3 to 7 times more psychoactive than regular inhaled cannabis. So now it's a lot stronger, and it took you longer to feel those effects. And then all of a sudden it's just way too much. So yeah.
That's definitely a pitfall to think about. And again, don't get overwhelmed. You're going to do great. Start low with that 1-to-1, pretty much 5 milligrams CBD, 5 THC, work your way up. You feel something back down, you're not feeling good enough, improve that CBD. And then when you're switching between products, if you know from your journal how many milligrams you take, it's easier to do. But be careful with the edibles because of the chemistry involved. 10 milligrams might really mean like 15 milligrams when you switch between those dosage forms. Something to think about. But as a pharmacist, what's awesome with cannabis, WHO report, there are no reports of fatal overdoses in the epidemiological literature. The safety profile is so strong. If you look on this chart in the middle, you'll see alcohol listed as a 10. Now, the way this chart works is essentially it's the ratio of fatal dose to effective dose. So if 2 shots of whiskey get you drunk, 2 times 10, which alcohol is a 10, which would be 20 shots of whiskey, could potentially be fatal. It's kind of how they use this. You've got another drug in here, dextromethorphan is a 10. Dextromethorphan is a cough syrup called Delsum, right? We get it over the counter all the time. Cannabis is, they're at the very, very top, and the safety is so strong. And the reason for that is that those CB1 receptors we talk about, the green and blue receptors, they're in such a limited concentration in the brain stem, in your brain, in the brain stem specifically, that you don't get the respiratory depression, which is what can end up being fatal with your Vicodins, your Oxycontins, your opioids, your fentanyls, your things like that. The safety profile is so great, which is encouraging. There was an example at one of the conferences I went to out west, and they said, to this point, 170-pound individual, if they took 100,000 milligrams, which you can't even buy, of THC, it would increase their risk of death by 50%. And how you visualized it, it was if you had 100 milligrams in each THC brownie, which that's a lot to begin with, you would have to eat 1,000 of those in one sitting, and then you would have a 50% chance, in theory, of death. So, I mean, that's a lot of brownies, and it's really encouraging.
And I think you have to do it in a 15-minute period, right?
It's pretty quick. Yeah. So,
good luck.
Yeah. So that's pretty fantastic. As far as THC in Florida, it can only come from a licensed dispensary. You've got to have a medical cannabis card to purchase it, and then you can go into the dispensary of your choice and purchase the product. There are a lot of questions about CBD.
I think one of the things you were mentioning is if you want to pick up CBD products, we have a website called My Botanical Wellness that allows people to be able to pick up doctor recommended CBD products. One of the problems that's in the market is if you're looking at just CBD only, not what the dispensary sell, because that's more of a higher concentration of THC. But if you're looking for a product that a doctor recommended CBD products, the My Botanical Wellness site will help you be able to address that issue, and it's safe, because it's doctor recommended, and also we have some discounts available, 20% discount if you're a first-time buyer, and another 10% if you're a medical NMTC patient. So.
Sure, Florida has come a long way in the CBD hemp market from even a year ago. I don't want to say there were bad actors out there, but there were a lot of products out on the shelves. Quite frankly, the people selling it didn't even know they were selling a bad thing. I like to think most people want to do right by the person, but Florida has come out, and if you're going to sell CBD, you've got to be licensed by the Department of Agriculture, and you have to have these certificate analysis, these little barcodes on your bottle that go back and show that this product was tested in a lab and it is what it says it is. And anytime you're going to buy a CBD product, I would look for something like that. Probably be careful in some of the gas stations and things like that. But Florida is cleaning that up within the state by making them follow all these rules. This website, certainly has some great products on there, with
and an extremely competitive price too. So.
That is, certainly a benefit.
That's pure CBD that we're talking about, right?
Pure CBD, no full spectrum CBD.
Right.
I don't know if you want to comment sometimes on full spectrum versus broad spectrum, but both those options are available. Full spectrum does well. That instead of an isolate, so you can buy isolate, which is like CBD only, and it's just at the end of the day, CBD is CBD. You got to be a little bit careful when you buy an isolate, just a pure CBD product, because the chemistry, they call them isomers, is there that chemical, there's variations. If you remember the THC CBD slide and what that chemical looks like,
right.
You can get different, what they call stereoisomers, and you get this, instead of like the normal patients do better like this, you actually get an inverse U, because you're not getting the traditional standard chemical that CBD is. But if you buy full spectrum, it's going to have the terpenes in it. It's going to have a little bit of THC, but like has to be less than 0.3%. It's basically none, but it has some because it came from a hemp cannabis type plant. And then your CBD dose as well.
And I want to mention that Move actually sells CBD products, hemp-based CBD products. And we're gonna be introducing that into this website within the next month. So be able to pick up some of that as well, about the Move products in that category. So,
yep.
Tell us about, there's upside. What's the downside, Cameron?
So potential adverse effects that you're going to have from cannabis, they're also pretty darn encouraging. Tired or sleepy, some patients will choose a product that encourages sleep. Like at night, I use a product with that beta-myrcene, which is a terpene that's from hops, beer, or lavender, linalool to help you sleep. And then, too much of a dose, going too fast, some patients, too much THC, you can get anxiety, things like that. But generally, I mean, you see these commercials and most big pharma medication side effects profiles are quite extensive, and these are pretty tame, which is encouraging. Drug interactions are pretty nominal at normal microdosing, normal doses. Anybody that's on a medication that has what we call narrow therapeutic index, meaning I go back to my doctor all the time to get blood work to check on the level of that medication. A lot of people get blood work for a lot of different things, but if you're specifically like phenytoin for seizures, looking that my amount circulating in my blood is between this number and that number, you're going to want to communicate that with that primary care provider. And if you notice, potentially at a high enough dose, that could alter those numbers a little bit. Same with Coumadin or warfarin. Most patients don't go more than 4 weeks without a test on that. So I used to work in a Coumadin clinic. Be open with them, let them know what you're taking. It has the potential to alter your level if you're going to be, between a 1 and 2 or 2 and 3, depending on the condition.
Cameron, there's a couple of things that aren't on here that's really important to point out. It can't kill you.
Definitely cannot kill you.
Cannot get addicted like opioids.
Yeah, this study
that's really important to point out.
Demonstrated virtually 90% of adverse effects were considered not serious. Tachycardia, that's come up a little bit. That's rapid heart rate. I've seen that more lately. When you're doing your dosing, if you're ever going to make a dose change, do it when you're at home. Probably do it on the weekend if you're at home on the weekend. That's a rapid heart rate. Just you don't want to get that. So definitely, if you go slow, you'll have if you're gonna have an adverse effect of tachycardia, rapid heart rate. That's one that has popped up every once in a while from too much stimulation, took too much of a dose. Start slow, take your time. We've waited this long, you're gonna do great. And I want to turn it over here to Kate.
Why don't you turn it over and I'll take the slide deck from here, and then what we'll do is what I'd like to do is I'll run the slide deck on my side, Cameron, because what I'd like to do is, Kate, you have some very interesting information. Now, can everyone see the slides? See the slide deck?
Yep.
Okay. The reason I point that out is because what's interesting is that Kate, you have some emulsification technologies that really are important, and I think it's important to move. We talk about that because that'll help answer a lot of the questions that we have, which we want to get to as soon as we finish this. So, Kate.
So yeah, so basically, what you'll find inside any of our Move dispensaries is our huge selection of products that are going to be really easy to help you find that right dosing for you. So like Cameron has been saying all along, start low, go slow. We have a lot of microdosing products, starting with our 72-hour transdermal patch. You can put that on essentially any part of your body. I would recommend putting it somewhere that doesn't have hair because it's kind of sticky, but you can put that on and you're going to get a slow release of 0.24 milligrams of THC released into the body per hour for 72 hours. Now, anytime you have around 3 milligrams of THC, it's associated with some cerebral fogginess. So you'll be able to feel it. These patches are 0.24, so you're really not going to feel it. You'll be able to drive your car, operate heavy machinery, go to school, pick up your kids without feeling like, oh, I shouldn't be doing this. So that's a great product for you. We also have our transdermal gels, which the first time you try those is probably recommended that it be before bed. And then we have our oral spray, which is less than 3 milligrams. So it's a great microdosing, something for during the day. It's about 1.9 milligrams per spray. And it's kind of like, I don't know the age range of everybody here, but I remember it to kind of be like a Banaka spray. So it's a spearmint flavor, very light microdosing, good to kind of get you through your day, not too much. And then we have, as you can see, we have a wide range of different products. Something to be careful about. Here. Okay, so here's our transdermal. So we have a patented technology that we have this in our Evolve transdermal gel, and we also offer this in our patch. And so basically, with this technology, we've broken down the particles of the cannabis to be so small that it basically tricks the skin, and it breaks through that barrier of the skin, gets into the bloodstream. So not only are you getting localized relief, but you're getting systemic relief too. But once again, it's a very small microdosed amount, so you're not gonna feel like you need to sit on the sofa. It's just kind of going to give you like an even keeled, slow release amount of that THC and CBD into your body throughout the day.
I got to tell you, I'm a big fan of the patches. They work. It's microdosing. It's easy. It's almost, and so all I do is like if I have my CBD patch on, I can then regulate the level of THC, or vice versa. If I have the CBD-THC patch on, I can regulate the amount of CBD that I'm using. I think they're. And the other thing about it, when people are getting started, if you put the patch on, you'll feel it working probably within 30 minutes. But if let's say it has an adverse effect, if you take it off, it'll stop working in about 30 minutes.
Right. We really haven't had a whole lot of feedback where there's any adverse effects. What I have heard from, I've been with the company now for 2 years, and I've heard a lot of people who've told me that they were on opiates for years, and they're not taking anything except for this patch. You're not feeling it cerebrally, but you're getting the relief that you need, so you can still get through your day without being too tired or couch blocked. So it's wonderful. A lot of patients really do like the patches.
Right. That's over here, and you can get it both as the evolved gel as well as the patch, right?
Right. And so, as Cameron was saying, that 1-to-1 ratio seems to do the trick. We, the people who make all of our plant medicines are PhD chemists with at least 10 years experience making plant medicines. And through all the studies that they've done, they found that 1-to-1 ratio is truly the best ratio to help you get that relief that you need.
Right.
Mm-hmm.
Not to mention, and then you have edibles.
Right. And so we partnered with Wana. Wana is the #1 gummy manufacturer in the US and Canada, and for very good reason. A couple of the things that I really like about the Wana soft chews is that instead of using gelatin to make them, we use pectin. And pectin is vegan. So a lot of patients are trying to clean up their diets and become more plant derived. So a lot of patients are vegan, so they appreciate the fact that it's made with pectin. What I like about the pectin, though, is that it has a very high melting point. So what that means is you can leave these soft chews inside your purse or leave them in the center console in your car, and they're not going to melt. Right. And they cut very easily. So maybe you don't want 10 milligrams. Maybe you want to cut that in half. Maybe you want to cut it in 4s. It's very easy to cut. In addition to that, we add between 30 and 40 terpenes to each of these 10 milligram pieces. So what you're getting is a much larger and huger terpene profile. And so what we're finding is that all of the healing properties from the cannabis are actually from the terpenes and the flavonoids. So by adding 30 to 40 terpenes to each of these chews, patients are getting more of an entourage effect and more healing properties, and they're really happy.
I also want to point out this one over here is a 1-to-1. Here's your THC to CBD 1-to-1, which you don't find a lot of 1-to-1 chewables.
Right. Yeah. And just for me surveying people throughout my day, most people who are using the soft chews, they're using an edible to get through their day, but they still need to work. They still need to, function, drive their car. They're using this, the strawberry lemonade, which is the 1-to-1, and oftentimes are cutting it into 4s or cutting it in half. So it's not too much, but it's just enough to relieve the patient of their pain and get them through their day.
Yeah, exactly. And then of course you have flower and vape pen.
Right. So yeah, and huge selection of flower, great selection of vape. We only use, we don't put any additives in our vape, so you don't have to worry about inhaling anything in addition to the concentrate itself.
And then you have plenty of dispensaries. I think you're opening a couple more pretty quickly.
Right. Yeah, we just opened up St. Augustine this weekend, which was our 32nd location. We're getting ready to open up a few more in the month of May and throughout the summer. So just keep coming to our website and see if we have a location that's close to you. In addition to that, we do offer delivery, and I would advise you to come into the dispensary just to get a tour of everything that we have. Sure. In addition to that, we just kind of started this program. If patients or even non-patients have any questions about our products, they can do a virtual walkthrough and get any of their questions answered. And it's that same phone number right there, the 880-5420. Patients can call in and set up an appointment and do a walkthrough either through Zoom or just over the phone, get any of their questions answered. and talk about what products might be best for
And
them.
those appointments are free. Is that correct?
Exactly. They can call as much as they want.
Great. Well, that tells quite a bit about, that's a little bit about Move. I obviously I'm a great fan of Move, especially the transdermal patches. Let's dig into some questions. Cameron Turner, do you want to take a few of these?
So I've been trying to get a few of these in the chat here.
It says they talk about the first one was about the dosing with gummies. I think we covered that one. Somebody, Rob asked, or Bob asked, excuse me, about, can you please address hybrids marijuana dosing?
Oh, I'll leave that. Kate, do you want to take that one?
Okay, what was the question? I'm sorry, I need to pull that
Please
up.
address hybrid marijuana dosing.
Okay, so as far as dosing, hybrid, what you're going to find is that almost all of the vape strains that we have, even the flower strains they're technically all hybrid. They just may be indica leaning or sativa leaning. And just like every individual is different, everybody needs a different amount of dosing. So it's hard to say what would be the exact dosing. Typically, but not all the time, patients do like a sativa for daytime relief. So if it's a hybrid and it's sativa leaning, they're gonna want to do that during the day. If it's a hybrid and it's indica leaning, that's going to probably make you a little bit more tired, and you're going to want to do that before bed.
Yeah. One of the questions that we have, it says clarify. It says patients. This is jumping on me. Please clarify the dosing for patients who have marijuana-induced dementia. I don't understand about marijuana-induced dementia. That doesn't. I'm not aware of that. Are you aware of that, Cameron Turner?
Well, there can be brain fog. I think they might be getting at a lot of people using potentially super therapeutic doses. Can get a bit of a fog. CBD can certainly help recover that, from that. Limit your doses, drug holidays. There's actually some evidence supporting the use of cannabis as some of its antioxidant properties for Alzheimer's and dementia. Actually, I had an opportunity to speak to a crowd down in St. Petersburg about that, and really interesting stuff coming out. Some people kind of chuckle a little bit, but with CBD specifically, I can honestly feel like down the road it's going to be a part of like a daily multivitamin for most people. There's just so much positive brain protective type stuff coming out in adults. I'm not really talking about the recreational market in anyone under the age of 24 because the brain's still developing, but once developed, at appropriate doses. I mean, it's the literature is just so powerful on it.
Yeah. One of the questions that comes up, it's Rob brought it up again, is all I've seen is 1-to-1 ratio of THC to CBD. Are there other ratios available at medical marijuana stores? Kate, you want to tackle that?
Yeah, absolutely. So we actually sell tincture in CBD and THC, and a lot of patients do actually like to create their own ratios. As Cameron says, and as the chemists at our company, they agree that the 1-to-1 is the best ratio, but that's not for everybody. And so some patients prefer to kind of, equalize it at their own rate. I would prefer a 10-to-1, 10 part CBD, 1 part THC. So I would just do 10 drops of the CBD tincture and 1 drop of the THC and put that in my drink. So you can kind of do that at your own ratio. At the same time, if you're using vapes, a lot of those come in different. It's not necessarily, well, I guess it would be a ratio. It's just different milligrams of each. So you can decide that once you're inside a dispensary, and a med tender can help you decipher, which is going to be best for you.
Yeah, I think when you go and you shop around, not just at Move, but other stores, you'll see a lot of 8-to-1s, 1-to-8s. The ratios are out there. You'll find that most medical marijuana stores have them. Again, one of the advantages that I love about Move is the fact that you don't have to worry about that. You can get CBD and THC, and you can kind of mix your own. And you don't have the problem with all the ratioed products is you got to buy another bottle to be able to figure out if it works. And the costs go driving up. What I love about movers, I can try a 1-to-1. I can try up 2 CBD to 1 THC. Like when I find that THC level, I can experiment by kicking up a little more CBD if I have inflammation. So you're able to basically, I wouldn't call it self-dose, but you're able to make it so that you can find your sweet spot a lot easier.
Right.
Right, it's there. Cameron, you want to grab one?
Why don't you read one out, Mark? I'm in the midst of trying to answer.
Okay. One of the questions that, and I want to hear Cassia asked is, what's the best form of administration for newbies? I feel like edibles are the hardest to dial in on and had some bad side effects. My tolerance is super low. Oops, hold on here. It's super low for THC. So what would you suggest for a newbie, Cameron?
Yeah, I'm a big fan in that situation of going with a sublingual drop, to be honest with you. It's so much easier to control. It's so dose consistent. From a pharmacist side of things, whenever you absorb it in the cheek and the buccal of the gum area, you're supposed to leave it in your mouth for like a minute before you swallow. It gets absorbed right into the bloodstream, skips the liver. You don't have a lot of conversion in the beginning, and you can dial in your dose. Edibles, to your point, it's a good point, can be a little bit more difficult for sure.
Yeah, I think edibles are harder to dial in. Most people start with sublinguals and then augment if you can, if inhalation is okay, augment with a vape pen. It would help quite a bit. So there's one over here. It says this is kind of a long one from Russell. Do you see the one from Russell? Well, let's take a quick one then from Linda. How do you go about dropping opioid usage when you are adding CBD and THC products?
Yeah, so that's a really great question. It's kind of a bag full, to be honest with you. What I always recommend is that you work directly with your physician that prescribed the opioids. They have a plan for tailoring doses back. It's a very consistent, studied, way to do it. In the very beginning, a lot of patients, and I don't know if that's what where we're at, didn't want to discuss their cannabis use with their primary care provider that was prescribing the opioids to them. Some of them were under paying contracts or were afraid of being kicked out of the program, things like that. So I would this may speak to more than just you, but definitely approach that with that physician. You can do it, casually. How do you feel about cannabis? Things like that. In the beginning, in some of the markets patients we were working with, we had issues with providers that, if you're going to use cannabis, you're not going to be my patient. Now that has completely changed in the last 2 years. We get a lot of referrals from pain management doctors. We get I think a lot of patients started leaving pain management, and the providers quickly learned the importance of cannabis as being a tool in their tool bag. So hopefully definitely just approach it with your provider. I can't specifically tell you how to do it.
Well, I think your formula of trying it 1-to-1 and then going through it, you'll by being able to go through that process, you'll be able to figure out how you can actually relieve your pain without having to rely on opiates.
Right. I would need a lot more information to be able to answer that question. And then there's some legal issues there as well.
But I think your doctor would be very helpful with that particular question.
Yes.
So, there's one that came in here, and that is that, do you know if Crohn's disease will affect absorption rates of oils and edibles?
Yeah, I mean, it could potentially. So for the most part, no, you're fine. Anti-inflammatory, the way the body transports the chemical, the CBD, THC across the gut lumen is unimpacted. You get the same type of diffusion. You get the medication really right at the site of action swallowing it is not generally a bad thing. Now, if we have some, severe Crohn's disorder where we've had so much of the GI tract surgically removed, that can change things, certainly. But generally, you're fine, completely fine.
Right. Now, one of the questions that's come up, and this was from an anonymous question, is it's kind of one question, so bear with here for a second. Is I have a NSAID-induced kidney disease and can no longer use most meds, alcohol to control pain. My PCP it looks like reached tramadol, but it is fogging, so I am experimenting with dosing with THC and CBD. Two questions. What would be a guesstimate dose for a 160-pound patient naive to THC who has chronic bronchitis and limited non-inhalant products? And two, how do you bring your PCP into the self-treatment program so that they can assess and treat optimally? Can you cite some peer references?
So chronic bronchitis, I would avoid that. It would just be smart to avoid anything that you inhale in that situation. I would focus on the sublingual drops in that patient. As far as kidney disorders, kidney disease is a caution. It's not a contraindication to use cannabis. It's usually a patient that's got significant renal impairment. So generally speaking, and we got plenty of patients with kidney disease that use cannabis and they do just fine. Dosing, it's again, let's see, what are we trying to treat? I can't remember.
Well, it's kidney disease. His last question.
They're using it for the kidney, or are we using it for adverse effects related to the kidney disease?
Well, one of the questions he had is what part of cannabis metabolizes by the kidneys that might be an independent risk factor for already damaged kidneys? So he's trying to treat kidney disease.
I'm gonna provide my email address to this person because it sounds like they want some literature as well.
Yeah, they're looking for peer reviews.
Yep.
Good. That'll be something quite a bit. Let's see. So Jerry's asking a question. I tried both. First time, no improvement. Tried 1-to-1. Now just THC. Still have lots of pain in my back and in my head. Taking 25 milligram Dopplers. You know what to do.
Again, I would keep it simple, stupid, and back up a little bit. Let's go back to the 1-to-1 ratio, CBD and THC, until we get started our 5 and 5, work our way up to 10, get to that minimum psychoactive dose, see where we're at, back up, and then start ramping up that CBD again to see if we can make progress. Take it slower this time. Give it time. I know it's frustrating that it's taking a while, but there's pretty much no recommendation that's going to say, oh, just go with THC. It's going to be a combo product and we're going to have to dial it in.
And one of the things that I found, and this has to do with working with my inflation from my knee surgery. One time I actually ran out of a ratio THC product and I started using a higher CBD product that day until I could go have my wife go to the store and pick up more product for me the next day. And I found that my pain level went down by using a higher CBD ratio product. And I think I came back and asked you, some of the doctors and yourself, Cameron, and it turns out that what happened was as I lowered the inflammation, it lowered the pain. And in my brain, I had equated THC to lowering pain. And what I found out was if I can lower the inflammation, it lowers pain, and that's CBD. So, that's where the testing of trying the 1-to-1, and you said, try the different things. It'll help you figure out where your sweet spot is. From that experience, I use a lot higher CBD today than I do THC for my particular situation. So,
beautiful.
Okay, let's see if there's any other. Tell me about HempWorks, the combination of hemp and CBD. Have you ever heard of that? I think HempWorks is a product, isn't it?
I'm not familiar with HempWorks.
Yeah, I think
Are
HempWorks
they
is a
asking
product.
the
And
difference
candidly, I think they
between?
sell CBD hemp. That's what they're selling. I
Okay.
think.
I'm also not
We
familiar.
may have to defer on that question because I don't think we know what HempWorks is. So
Unless they're asking what the difference between CBD from hemp versus CBD from the marijuana plant is.
that's a good question to answer. Kate, why don't you take that one?
Right. So they're basically, and I think Marc, you've given this explanation before. It's basically CBD is from hemp versus the marijuana plant is similar to like roses. Yes, a rose is the same plant. However, they show different properties. So CBD from hemp is it's although it has anti-inflammatory effects, it's going to be a much smaller amount. So I don't know exactly what the amount is. Maybe Cameron would know, but it's going to be like taking a very small dose of ibuprofen for anti-inflammatory versus the CBD that's from the marijuana plant. You're going to have a much higher percentage of anti-inflammation effects. So
I think that and also the terpenes come into play.
Right.
Yeah, much better terpene profiles. I've had friends of mine tell me that people that are in the industry, especially the hemp industry, that hemp's like beer and marijuana is like whiskey. You know, one is a lot more stronger than the other when you go to use it. There is
yeah. And so what patients have told me is when they're used to using the CBD that they get at CVS or Walgreens versus the CBD that they get from a dispensary, it's tenfold, a lot stronger, a lot more effective at working on their inflammation.
Yeah, I think HempWorks is actually, I just looked real quick. It looks like it's a brand of CBD products. So at the end of the day, again, 10 milligrams of CBD from hemp is the same as 10 milligrams of CBD from cannabis. If you're talking about specifically CBD product, but you want to make sure it's from a reputable source so that you can look online at the certificate of analysis and know that it is what it says it is.
Right. Cameron, Russell had quite a long question and fairly complex. I think what we may want to do, Russell, if you don't mind, we're going to provide you, Cameron, can you provide his email address to him and you can answer his question for him? That might be the best way to handle it.
Okay. Great.
Cool. So I think we have most of the questions answered at this point in time. If somebody has any other questions, okay, what are the options on RSO, Rick Simpson oil? Kate, you want to take that one?
Okay, well, so luckily at our company, we have a lot of different options for RSO. RSO stands for Rick Simpson oil. If you're not familiar, go to YouTube after this and look up Rick Simpson oil. Basically, they've taken nothing out of the plant to make this Rick Simpson oil. So you're going to have all those terpenes, you're going to have all the flavonoids, all the healing properties. So typically patients who are looking for all the healing properties, mainly patients who have cancer, they're going through some chemo and radiation, they want those added healing properties, they look for this RSO. So we have RSO in three different, you can get it in three different things. One, we have it in a tincture, and that tincture that we have is fat soluble. So it's going to be the same feeling as an edible. It's going to last a long time. It's going to take a little bit longer for you to feel those effects, but a lot of patients really do like the RSO in the tincture. It comes in different strains, so you can look for, if you're looking for more of an indica or more of a hybrid or sativa, we'll have that available in the dispensary. We also have the RSO in a capsule. And, although we have all these different routes of administration, at the end of the day, all of the patients out there are very comfortable swallowing a pill. It's easy, you get the dosing correct. The RSO that we have for the capsule is 25 milligrams, which can be a little bit strong at first. So a lot of patients, what they'll do is they'll open that capsule up and pour half of it in their drink. And then that way they're getting 12.5 milligrams instead of 25.
That's a good point.
We also have it in a concentrate, which it comes in a syringe. and you just do a little dropper onto some wax paper and measure out basically the size of a grain of rice to get 25 milligrams. Once again, 25 milligrams is a lot. A lot of patients choose to kind of cut that down into smaller dosings until they find that correct dose for themselves. But yeah, definitely do some research on RSO and see what the regimen is for, if, let's just say, for example, you have cancer and you're trying to go through this Rick Simpson oil therapy. It'd be something good to look up. I can't really advise exactly what it is. But
I know some people who use your RSO products and they're very effective. So again, good recommendations have come from that.
Absolutely.
One of the questions that Susan brought up is, with all products, will all products cause heart palpitations or just inhalation products?
No, not at all. And and a lot of times not even inhalation products. Everyone's different. So usually when the palpitations occur, it's from too much THC. So dialing that back, obviously a topical, depending on the situation, typically works more locally. Like if you got pain in your knee or your wrist, I really don't see any palpitations in general from that. And really any of the products, but it's a potential adverse effect that could occur. And for most patients, if you do this normal microdosing, small dose, you're setting yourself up to have such a limited risk of that. It's when we jump into these high doses that risk increases exponentially if it's going to happen.
Yeah, I don't think it makes any difference to route of administration. It's the amount of it's that high dosage that causes that problem.
Yeah, in general, I mean, everyone's different. Everybody can be more sensitive and whatnot.
Sure.
So
Nick was asking Kate, are you going to go out west? I know Nick's from Colorado. I think he wants to see you in Colorado.
Oh, what's that?
With your merger last November, that may be in the plans in the next year or two.
Absolutely. Keep following us.
But you're also in Arizona. That move is in Arizona, right?
Yes, we actually got our start in Arizona.
Right.
And but back in November of 2020, we merged with Verano Holdings, and they're in 14.
Right.
Over there at some point.
Cool. So one last question is,
and then
I
saw a question.
Oh, I'm sorry. Excuse me.
I was going to say the same thing.
CBD is working. Like cannabis, I listen to my body. I mean, there's all this theory and all kinds of good stuff. What I find is I listen to my body. If I take it and I wait an hour, it's not like take it and 5 minutes later. If I'm trying to reduce my pain or my inflammation in my knees, I can feel it. In my back, I can feel it. And I know if it's there or not. My body will tell me. I don't need a doctor. I don't need any third party. Just give yourself about an hour, have some patience, and then you'll be able to tell yourself if it's working or not. I don't think there's a barometer that's out there that you need to worry about. What's your thoughts, Cameron?
Yeah, I agree with that. I mean, I think a lot of patients sometimes will forget, how bad they were, and then when they stop it, they realize, okay, yeah, it really was helping. If nothing else, the antioxidant properties, the brain protection properties that are coming out in some of the Alzheimer's studies and things like that is pretty fantastic. But it depends on the condition you're treating to know whether it's working. So there's some behind the scenes work that you may not know is helping, but then if you're dealing with pain or anxiety, things like that, over time, with appropriate dosing and dosing titration, you'll get to a point where it's working and you're doing better. Just don't walk into a dispensary, please, and just get overwhelmed, because it can be overwhelming. Always remember, just step back, keep it simple, stupid, focus on starting low, going slow. Don't let yourself get overwhelmed. You've made it this far. If you change your dose up or down on 7-day increments, for the most part, you're going to do great.
And I know, Kate, in the case of Move products, your encapsulated technology not only helps products work faster, but also you need less of them.
Correct. Yeah. So, for example, most of the capsules that you're going to find on the market, not our capsules, but our competitors, those are going to be more of an edible effect. So it's going to take longer for you to feel the effects, and it's going to amplify those effects. Whereas if you take 25 milligrams of the RSO capsule of ours. That's water soluble. It has that encapsulation technology. You're going to feel the effects within about 20 minutes because it's getting into your bloodstream as opposed to getting digested and getting converted in the liver. So you're going to feel those effects a lot sooner, and it's truly going to be whatever those milligrams that you took. So a little bit nicer for dosing when you're first starting out and trying to figure out where your happy spot is.
Super. Well, listen, we've had a very long webinar, it's about an hour and 50 minutes, and covered a lot of territory on dosing, a very important subject. I want to thank everybody for actually hanging in there with us. I know it's been very long, and hopefully you're getting a lot out of it. The goal of these webinars is if we can help one person get their life back, help one person be able to live the life that they want to live, then we feel like we've accomplished something. So I'd like to wrap it up a little bit. Kate, any last closing comments?
Just thank you for tuning in for so long. Cameron, thank you for all of your information, all your knowledge. Marc, thank you for putting these on. And definitely, if any of you have any questions further for our dispensary, I encourage you to come to our website, or you can go to our 800 number. It's 833-880-5420. You can do a virtual walk through our dispensary, whether you're a patient or even if you're not a patient and thinking of becoming a patient. They can walk you through everything, show you the process, introduce you to some of our products, and answer any questions that you might have. But thank you for your time tonight, and I really appreciate you guys tuning in.
Yep.
Okay, thank you very much. And as I mentioned, you're going to get a follow-up of this webinar with the video, copy of the presentation, copy of the questions and answers, as well as the resources and links to strain print, as well as the patient information brochure. Cameron, you got any closing comments? And thank you very much, Cameron, for your comments. I know it's been...
Oh, you're very welcome. No, I really enjoyed connecting with all the participants tonight. I hope you all enjoyed it. Hope it was more of a chat. Closing comments, be well. You got this. You're going to be fine. Take your time. There's no rush. You'll get there. We're going to win the race at the end of the day. So appreciate y'all tuning in, and it's a true honor. So thank you.
Kate, thank you, and Move for not only your comments today, were very helpful, and also for the sponsorship. Cameron, your insights, as usual, are sage, and we really appreciate them. I'm going to throw in a shameless plug. Next week, we have another one of these medical marijuana and wellness webinars. It's on seniors, or for seniors in medical cannabis. It'll be next Wednesday, so please feel free to RSVP at the Marijuana Aware site. And I want to thank everybody for taking the time. I know this has been a long webinar, but hopefully it's been fruitful, and hopefully it'll help you get your life back. Thank you very much, and have a good evening.
Yeah.
Thanks, everyone.
Thank you. Bye-bye.